Things are always a little harder on holidays because you know that people's families are around, they're surrounded by people they know and love, and when something like this happens, it just seems worse because it's on a holiday.
Well, that day, like many of the other days in December, the weather was bad.
We got a call for a flight outside of Happy Valley.
As we were approaching the scene, the ambulance already had the patient loaded into the back with the first responders, and so they wanted to do an intercept. And so what that means is we'll go to a pre-designated position and meet the ambulance there and offload, usually hot, into the helicopter and then take the patient to the hospital.
While we were en route, we were told that the ambulance crew had already been on scene and wanted us to meet them at the hospital. An 11-year-old female who had bilateral amputations, and that she was critical and that they wanted to get her to the hospital and we would be meeting her there. I'm Lisa Halverson. I'm a flight nurse for LifeMed Alaska.
Natalie Morgan. I'm a flight paramedic with LifeMed Alaska.
My name is Andrew Bussey. I'm a helicopter pilot for LifeMed. And we had low ceilings in Soldotna.
Usually we're called to a scene call. We do land on scene. In this case, they felt that it would be more timely to get her to a facility and us to meet there. And it ended up being a very good call by the local EMS, because by the time we arrived at the hospital, they were already taking her to a CT scan.
So we walked in with them and we were able to discuss with the doctor while she was being scanned some of the things, and we got to hear things firsthand from him talking about treatments.
On Christmas, it's really hard to digest and interpret an accident of that magnitude, especially with patients that are that young. And when I came back into the Homer Hospital, you could sense that the Christmas spirit was maybe not as present as before, and that the entire hospital was a little more somber, and the emotions and the faces, you knew something was real critical and very serious. And a gentleman stopped me and asked if he could ride along. And you could tell immediately that it was the patient's father. We didn't have the best weather, and so I put extra fuel on. And so even with a light crew and a light patient, I used our extra load for fuel just in the event that we had to deviate and not make our normal crossing. And so I had to tell this gentleman no, that he couldn't ride along. It was probably one of the hardest answers I've ever had to give, especially with a father who just suffered such a traumatic incident, and then to tell him he had to take a separate plane to Anchorage. It was really difficult. I'm very proud of my team, Lisa, Natalie, and my other crew members that weren't on that flight with me.
And I'm really glad that in this case our best was enough and that we were able to keep her stable enough into the hospital in Anchorage where she could have the life-saving surgeries that she had and get excellent treatment there.